This is part two of the intravenous fluid um, administration in the care of patients. I stopped the part one abruptly uh, because of time, because the shorter it is, the more attractive it is for the community to listen to it and get the benefit. Example I was given is if a patient is hypotensive, that the appropriate fluid to give to the patient would be normal saline or lactate ringer. The use of D5 water or D5 half in this particular patient is inappropriate. At the same time, if someone is hypotensive but has a very severe hyperglycemia, you first need to treat the hypotension by using a volume expander such as normal saline or lactate ringer, while at the same time deal with giving the patient free water in order for the concentration of that glucose to be diluted to a place where it's not going to cause the patient any more harm. So you can start with normal saline to resuscitate the patient's volume, and then change to D5 half normal saline. And in certain cases, free water use may be appropriate. So the type of fluid you give can either be helpful to the patient or be detrimental. So you can kill the patient or you can save the patient. The relationship between the volume of the patient and the electrolytes, for instance, somebody who has high salt level, if you check the blood and the sodium is 168, but the patient's blood pressure is 90/60, which means the patient is hypotensive. Even though he's very hypernatremic, has too much salt, the treatment for this patient is not going to mean I want to lower the level of the sodium very fast, because if you do so by giving free water and lower it to normal level, the patient most likely will end up having a seizure and die from it, because the brain needs some time for the idiogenic osmoles to readjust. Otherwise, they are going to absorb water from the periphery into the brain, and the patient's brain swells and the patient dies. So you can see that you don't just give patients fluid without knowing which fluid is appropriate for the patient. So when you go to your doctor when you are ill, and your doctor does not give you drip or the so-called IV fluid, don't consider that as inappropriate medical management, because that's actually the proper thing to do for you in this circumstance to save your life. If somebody has acute kidney failure, the patient may need some fluid to minimize low blood volume going to the kidneys in an attempt to make sure that that acute kidney failure does not become permanent. If somebody has heart failure sometimes will be accompanied by excessive volume. You don't give IV fluid to someone with excessive volume, or he's going to drown in his own fluid. Therefore, the benefit of IV fluid in a patient is very much part of medical practice. At the same time, knowing the type of fluid to be given and when to give it is very important. So a patient should not be demanding IV fluid from a doctor without knowing whether you need the IV fluid or not. And what I'm going to give an example here, which I hope is going to help illustrate how we can be killed by the use of IV fluid. There was a patient in Nigeria who happened to have a stroke. And this stroke came because of an illness that required for him to take some blood thinners. And so the blood vessel busted in his brain, and he had a stroke and was lying somewhere around his compound, and somebody found him. He was a 30-something-year-old man, and they took him to a hospital in one of the villages in Nnewi local government, despite the fact that it's a teaching hospital at Nnewi. And the young man there who was treating him, after evaluating him, decided to give him IV fluid in order to treat his hypernatremia. The hypernatremia, too much sodium. He had sodium of 168 when he was admitted. 2 days later, when they called me and I took a look at the patient's labs, his sodium was 118. So I can pretty much tell you that in this circumstance that the doctor contributed to the death of the patient. The kind of fluid you give, when you give it, is very important. There are circumstances where instead of giving fluid, you restrict the patient from drinking water or any other free water from any source. Because when you restrict water, for instance, in a person who has severe low sodium or hyponatremia, then the salt level comes back to normal by simple fluid restriction. But if you go and give this patient free water, you will kill him. So I hope that this encourages you to recognize the fact that the use of IV fluid or drip is not appropriate in all medical settings. It can save life and it can kill. And hopefully, it will discourage you from pushing your physician to give you IV fluid as an evidence that you are getting your money's worth, unless you are absolutely sure that you need the IV fluid.